Hello, everyone, and welcome to The Wrap, brought to you by Michigan Medicine Headlines. I'm Dan Ellman with the Department of Communication.
And I'm Brandon Beyer, also with the Department of Communication and the Office for Health Equity and Inclusion. I'm making my debut today as Dan's co-host as we discuss two important occasions, Healthcare Equity Month and Black Maternal Health Week.
Now, before we get into that discussion, be sure you go back and get caught up on any episode of The Wrap you may have missed. You can find the shows on iTunes, Stitcher, Google Play, or any other podcast hosting platform. New shows debut weekly and can also be found on the Michigan Medicine YouTube channel and as part of the Headlines Week in Review.
With that, let's bring in Dr. Okeyama Meije and Dr. Courtney Townsell. Thank you both for joining us.
Now, first, can you explain your roles in the organization as well as your roles in Healthcare Equity Month and Black Maternal Health Week?
Sure, I can go first. I'm Okeyama Meije. I am a faculty member in obstetrics and gynecology and a practicing clinician. And I also have an administrative role as the Associate Chief Clinical Officer for Health Equity for the University of Michigan Medical Group. And in that role, I have led the development and implementation of U of M Healthcare Equity Month, which is our first ever for the institution. And I'm really excited about the offerings that we have starting March 20th.
Right. And I am Courtney Townsell, one of the maternal fetal medicine specialists in the Department of OBGYN as well. My administrative role is the Associate Chair for Diversity, Equity, and Inclusion. And in that role, in our department, I have led the efforts for planning our Black Maternal Health Week.
Great. So first of all, would you guys be able to go into the origins and purpose of Healthcare Equity Month and explain some of the reasons for having it, as well as Black Maternal Health Week?
Great. In my role over the past year, I noticed that there are a lot of great efforts being done to elevate and showcase and address issues of healthcare inequities within our walls at Michigan Medicine. However, I felt as though it would be really important to try to organize all the different stakeholders together to be able to showcase and elevate the work that's being done and also draw attention to things that we need to focus on and things that we're working and addressing moving forward as part of our strategic initiatives. And as a practicing OBGYN, I also felt that it was quite important that we include Black Maternal Health Week as a capstone to our inaugural U of M Healthcare Equity Month. Historically, April has been National Minority Health Month, and in 2023, we know that the focus on historically underrepresented and marginalized groups extends well beyond those that are Black or Latin origin. And so there are many more groups that are now under that umbrella that we need to consider. And I thought this would be a great opportunity to highlight that and then capstone with Black Maternal Health Week, April 11th through 17th.
And just to piggyback off of that, for Black Maternal Health Week, we know in the United States that Black and African-American women are 3 to 5 times more likely to die in childbirth or as a result of complications of childbirth. And so it's a time to really come together, recognize the harm and the risk that African-American women and Black identifying women face as they enter this part of their reproductive lifespan, and come together and really come up with solutions and just make sure there's awareness.
Yeah, and I'm so glad you mentioned some of the specific inequities that are out there. So what are some of the things we all can do here at Michigan Medicine to address disparities in healthcare equity and improve access to healthcare for underserved and marginalized populations?
I think first and foremost, it takes one or the organization to examine things from a health equity lens standpoint. So if we want to consider what are some social and political factors that may impede one's access to care or their ability to continuously engage in care. And I think this makes us think a little bit outside of the box because historically as clinicians or care providers, where we see an individual, a family in front of us and immediate thought is, how do we help them get better? How do we address their medical needs? But we have to consider sometimes that their medical needs are driven by other factors that are well beyond the walls of traditional medicine. And that can be the environment in which they live, how they're able to gain employment to support themselves and their families, which we know can affect their ability to follow up with recommendations that we offer them for their care. Also how they may be able to gain access to healthy food, exercise, the list goes on. Transportation, when we want patients to come in for their clinical visits, and transportation is a barrier. We have to think outside the box as to how we make things a little bit more equitable and accessible and fair for all the patients we serve at Michigan Medicine. So I think that as individuals, organizations, and groups here at Michigan Medicine want to start thinking about a healthcare equity, we really have to examine and think outside the box. What are some other contributing factors that affect how a patient and their family may show up for care within our system?
And as it relates to Black Maternal Health Week, I think Dr. Okiyoma, Dr. Meje, she hit it on the head. There's many sort of social determinants of health that we have to kind of keep in mind. But as it's specific to Black mothers, I think we also have to acknowledge the structural racism that has been sort of present in the healthcare system, as well as, pervasively outside of that.
Well, I think I just want to follow up real quick. I love that you are talking about so many factors outside of just patient care, right? So there's so many things that no matter what our role is here, we can help with, whether it's improving communication to marginalized populations, or if you work in Michigan Medicine lodging and providing lodging to maybe some populations that, their family members can't afford to stay with them, to travel and stay with them, or stay in a hotel and things like that. That really any role you have, right, can sort of help improve outcomes for our patients.
I would definitely agree.
Oh, go ahead.
Yeah, I would definitely agree with that. One of the national campaigns from the CDC is the Hear Her campaign. And I think there's so many touch points that patients have within the healthcare system, coming to the front desk, making a phone call and scheduling an appointment before they even reach the clinician level. And so everyone has a role in how they interface with patients, how they interact, and really how they receive and make patients feel welcomed.
So, and in light of those needs and disparities that exist, can you talk about some of the activities and things that are taking place during Healthcare Equity Month and also Black Maternal Health Week?
Right. So as Dr. Meje mentioned, Black Maternal Health Week occurs from April 11th through April 17th. So our activities begin that Tuesday, April 11th, where we'll be partnering with the OB interest group, the medical student organization, to do a social media takeover and really take over a couple of really important Twitter and Instagram accounts here to get some of those statistics out, so that awareness is, that we bring that awareness level that these statistics are present, and that this is a real issue. As we move into Wednesday, we have a research day, and in the morning, we have a really amazing panel. Miss Ella Green Moten is the incoming American Public Health Association president-elect, as well as Dr. Erica Marsh. They'll be headlining a panel discussion where we talk about centering equity through inclusive recruitment and community-based participatory research, because we know that a lot of this is happening at the clinical level, but we need to think about research and how that can inform how we care for our patients and how we show up for our patients. As we move into Thursday, we have a grand rounds where we'll be talking about birthing justice and equity and Black maternal health outcomes. And we have a panelist from Birth Detroit, Leslie Welch, as well as our own Lisa Kane Lowe and Dr. Elizabeth Langen, talking about some grassroots and on the ground work that we're doing here in Michigan. And then that afternoon, there's a nice cross-departmental offering where we're going to be screening the documentary Aftershock, which chronicles kind of the aftermath of when we lose a Black mother, right? We have the father left, the baby, some family members, but there's a big void that happens in that family. And what is that aftermath or that aftershock that happens in that community? And so we have the Department of Psychiatry, Family Medicine, Anesthesiology, and Obstetrics and Gynecology coming together to really make sure that all parties across the Michigan Medicine are aware of this issue. On Friday, the 14th, we'll have a Black Maternal Health Matters celebration on our labor and delivery unit, where we just acknowledge that Black birth is beautiful, it should be safe, and we advocate for Black maternal health here at Michigan Medicine. And then we'll capstone the week on the 16th, that Sunday, with a community facing event at Washtenaw Community College, where we'll screen toxic, and there'll be a panel discussion with community members.
Yeah, so that is going to be a busy week indeed, but one that is the first ever, I think, that we've had focused attention on Black Maternal Health Week as an institution. And I'm really glad that that has come together very nicely. So I'll just highlight some events that we have for the health system and campus in general. Starting March 20th, Mishar is going to be hosting a community engagement health equity panel with the members of Mishar, and then two keynote events. The first being on March 28th. Dr. Arlene Geronimus, who's a professor in School of Public Health, is going to be present and having a book launch. Her book is titled Weathering, and that book focuses on the impact of inequities and how it actually manifests physically as high blood pressure, decreased lifespan, diabetes, and she chronicles her long career of research on this topic, and the weathering phenomenon is a term that she has coined, and she is that is associated with her and all of her research, and she's going to be talking about all that work in her book on March 28th. Then we have another keynote speaker, Dr. Chris Purnell. Dr. Chris Purnell is a nationally known individual, oftentimes making the news stands on CNN or MSNBC, talking about healthcare inequities, and she's going to be our keynote on April 4th. She's going to be with us and speaking about her work and how people can engage in this work. And so that is our second keynote event. We have a session that I'm really excited to talk about, is that Dr. Monica Colvin and Dr. Silas Norman here at Michigan Medicine are going to be talking about inequities in heart transplant and renal transplantation. And we know that race-based calculators related to kidney function have affected individuals' ability to get a fair share at kidney transplantation. So they'll be talking about that on April 6th. On April 10th, we're actually going to be having a session led by Dr. Joel Howell, the historian for the university. He's going to be talking about the art on our walls at Michigan Medicine and how our values should reflect what are on our walls at Michigan Medicine. I'm really excited about that discussion. And we're going to talk to the curator, Elaine Sims, who's part of the, designs our art collections. We're going to talk about how do we become more inclusive in the artwork that we share on our walls, and what are some of the ones that may need to come down. And so there are tons of highlights, but another that I'd like to highlight is that the radiology department, along with Michigan Medicine leadership and community members, are going to be talking about the impact that the mobile mammography unit that launched at Ypsi Health Center is having. And that session, I believe, will be on the 6th of April. So yes, we have a host of different activities. Another community-facing event is going to be skin cancer screening that's going to be done at the Hope Clinic with the Department of Dermatology. And there are many other conversations that are going to be had. The anesthesia department is going to be hosting the viewing and discussion of the Henrietta Lacks film, which is a film chronicling the story of a woman who is universally known when it comes to cervical cancer research, and her cell lines were used without her permission or recognition. And anyone who's done any type of basic science research has used the origins of her cells. And so her family story, her story is going to be shown in this film, and then a discussion will be followed by anesthesia. So I encourage everyone to go onto the website and look at the host of events that we have and register for them too. They're probably almost 30 events at this point. And at this point, we're actually telling some people, maybe we need to table your event for 2024.
I
because
mean,
yes.
It's incredible. And so many of them sound so fascinating. I'm like a history nerd, so all of what you're talking about sounds fascinating. The art conversation sounds amazing. I'm like super excited for all of those events now. So outside of the events and registering for them, are there things faculty and staff can do to get involved with Healthcare Equity Month and Black Maternal Health Week to ensure that it continues to grow and flourish here at Michigan Medicine?
I think my first thought is that for those that are department leaders or supervisors, please allow your staff and those who you work with the opportunity to, have some protected time to engage in a few of the events. We do recognize that a lot of them are during business hours, so it may be a bit of an additional ask for staff and for their supervisors, but do allow people the opportunity to engage in the sessions if they can. I implore every faculty or staff member, maybe just if it's 1 or 2 events over the course of the month, that you register for and make a point to attend, because I think it'll pique your interest and hopefully get you thinking about what can I do, what can my unit do, what can my department do in the future, and rest assured there'll be 2024. So you have an opportunity to start thinking about that, and people have been asking, and I said, okay, fall 2023, we'll start the process for 2024. So you can at least have it in your mind and kind of start thinking ahead.
Yeah, and for the Black Maternal Health Week events, we will, start the week off with social media blasts. And I think if folks can just retweet some of those statistics and comments and patient voices and stories, I think that will really spread the message far beyond Michigan medicine and in the state of Michigan. And that's really what we want.
And the final thing I'd also like to add to that, there may be some people who are like, this is all new to me. I'm still just learning. I don't know where or how to get started. And I will encourage you, the first week of events starting on March 20th across the health system, there's going to be a panel that's just titled Getting Involved in Health Equity Initiatives. Is going to be individuals across Michigan medicine who are going to talk about ways in which you can potentially get involved in the future. And so you're very much able to kind of start there if you're just like wondering, what do I do and how can I get started? So that first week, there are a host of different sessions being facilitated. For example, another one from the Spectrum Center, which is a center located on Central Campus. They have a session on March 22nd that's titled Toward Solidarity, Allyship in Action. So we know that sometimes, like as I said, some people may not know where to start, but at least you can support your colleagues and others who may be interested in this area of work and want to, be involved. You can support them in the work that they're doing, even if you don't have a direct kind of driver role per se.
That's wonderful. I mean, it sounds like there's a wealth of activities and sessions where pretty much anyone can engage, and I think that's amazing. I too think that the artwork and the history one is really interesting to me as a former history major in my undergrad. So I'll definitely be attending that. Well, thank you both so much for sharing this information with the audience. I think it's a great opportunity to engage, and I think people should really take advantage of as much as possible. So now your work here isn't quite done, Dr. Majay. You've been chosen to participate in our lightning round. We're going to ask our guests a few quick fire questions. Are you ready to go?
Let's go.
All right, so we've talked about history. It's Women's History Month. Who are some of the biggest women mentors you have had in your career who've helped you over the years?
In my career over the years, I would say Dr. Janelle Coleman. I've known her since I was a resident in training, and we've collaborated and done great work together. I would say Dr. Dee Fenner, the chair of my department, has been very supportive in my development and growth. I would say Dr. Erica Marsh, Dr. Vanessa Dalton, Dr. Maya Hamoud. These are all, Dr. Lise Quint. These are all faculty. Oh, Dr. Craig Cohen at UCSF. He was one of my first mentors. So I've had a host of mentors over the years, and they serve in different capacities, and it's been great, and just keep moving and pushing forward.
All right, question 2. So everyone's got kind of spring and spring break on their minds. Where would your ideal vacation destination be?
My ideal vacation destination, a beach, warm, white sand, blue waters.
So pretty much anywhere but here. That's what it sounds like.
Anywhere that's warm and in March right now. Yeah.
Yeah. All right. Of course, March Madness is going on now. Are you into college basketball? And if not, do you have another favorite sport?
I am somewhat into college basketball, but after the games yesterday, quite disappointed because I'm sure a lot of people's brackets fell apart. And football is one that I probably do follow the closest of the collegiate sports.
I was also disappointed Michigan didn't make the tournament this year. All right. If you could go back and meet anyone from history, who would it be and why?
I think I would love to meet Ruth Bader Ginsburg.
It's a good choice.
And the reason being is because I think, I mean, she was a force to reckon with when she was alive and actively working, but just in reading about the things that she was engaged in and the work that she did and the initiatives that she pushed forward, in after her passing, it was, I mean, she was a leader well ahead and beyond her time.
Love it. Thank you so much, Dr. Majay, for being a good sport today, for sharing information on Healthcare Equity Month and Black Maternal Health Week. If you want to learn more about those events, go to mmheadlines.org. That's mmheadlines.org. All right, now, Brandon, as you mentioned, it's your first time co-hosting the Wrap. So tell our listeners and viewers, who the heck are you?
Well, so now I'm on the spot.
You're on the spot.
So I grew up in Ann Arbor, in a little town outside of Ann Arbor called Manchester. It's just to the southwest, and it's a very small farming community. I went to U of M for my undergraduate, and as I mentioned before, my undergrad degree is in history from LS&A. Prior to working here at Michigan Medicine, I did communications and marketing work at the College of Engineering for quite a few years. I was at the Department of Biomedical Engineering, which was actually part of the medical school as a basic science department. So in my free time, I really enjoy playing hockey. I travel, I like to hike, and then I'm currently working on my MBA. And I also have an 11-month-old golden doodle named Luca, who is a handful, but he's really cute.
I can imagine that he's a handful. That's awesome. All right, it's time for the weekly trivia contest. Last episode, we asked listeners, a new wellness website was recently created for which group at Michigan Medicine? The answer was house officers. Congratulations to Teresa Kane, a patient safety specialist, who sent in the correct answer. Now for this week's question, here's Brandon.
So this week's question is, what is the name of the implicit bias training now being offered in a self-guided format? Once again, what is the name of the implicit bias training now being offered in a self-guided format? You can find the answer in headlines, and once you know, send it to headlines@med.umich.edu for a chance to win a prize.
That's all the time we have for this week. Thank you to Dr. Majay and Dr. Townsell for joining us today. And thanks, as always, to all of our listeners and viewers for everything you do for patients, families, and each other. We'll see you next week.